Established in the year 1892, the Department of Pathology at McGill University has been one of the most academic pathology departments in the world. Many outstanding individuals had worked and studied in this department, such as Dr. William Osler, who was called the father of modern medicine, Dr. Maud Abbott, who was the first female physician in North America, and Dr. John McCurry, who wrote the famous poem, The Flanders Field, during the First World War. Today, expert pathologists in the Department of Pathology at McGill University offer completely subspecialized diagnostic services to a population of 1.7 million people, geographically located in the Royal Victoria Hospital, the Montreal General Hospital, the Montreal Children's Hospital, Lachine Hospital, St. Mary's Hospital, Jewish General Hospital, Montreal Chest Institute, and Montreal Neurological Hospital. The Department of Pathology is regarded as one of the most integrated clinical departments at McGill that contributes to multidisciplinary patient care. The department's signature clinical strengths include a completely subspecialized surgical pathology service, cytopathology service, molecular pathology, and cancer cytogenetic program.
As I think most of you know, the workup, the gold standard to the workup of any lymph node or lymphoid lesion is the incisional or the excisional biopsy or even the resection. And then the FNA cytology is, of course, much more controversial. It's used primarily for carcinomas. It can also be useful for reactive, and it's most controversial for lymphomas, as we'll discuss.
We are here in the Molecular Pathology Center of the Jewish General Hospital, and this Molecular Pathology Center is part of the Department of Pathology. So now this Department of Pathology is indeed separated between a surgical pathology unit and a molecular pathology unit. And you asked about the missions of this Molecular Pathology Center. So the missions are three. First is to provide cutting-edge molecular tests to the patients. And this is very important in the context of personalized medicine. Two is to play a significant role in research, not only in Quebec, but also at the international level, especially for molecular pathology and personalized medicine. And three is to play a role in teaching the new generation of pathologists and scientists in Quebec.
The Department of Pathology has been the home of several internationally leading research programs, including the Henry Whiteson Ocular Pathology Research Laboratory located at the Lyman Duff Building, the Respiratory Disease Research Laboratory located at the Montreal Chest Institute, and the X chromosome and Cancer Research Laboratory located at the Lady Davis Research Institute.
We decided to invest heavily in new types of technology that will allow us to get us multidimensional overviews of what's happening inside a tumor. In combination of gene expression, gene mutation analysis, and classical histopathological image analysis, as well as multiplex fluorescent images analysis, gives us a complete overview of what's really happening in a tumor, both in clinical samples as well as for research purposes.
Our laboratory has basically three missions. They go hand in hand, and they're impossible to be dissociated from each other. The first one is the patient care or clinical care. Second is teaching, and thirdly, research. I believe the laboratory is internationally renowned and very well known for uveomelanoma, ocular toxoplasmosis, and other rare ocular diseases. In particular, uveomelanoma, due to the fact that we have unique animal models and we develop unique clinical trials.
My research and my team research has been focused on identifying molecular targets in allergic disease, particularly in asthma, with our aim to find a new therapeutic approaches. To make our research more relevant to the disease, particularly in asthma and COPD. And our aim is to try and find biomarkers that can identify the disease process. So we look at the level of DNA, RNA, and protein using a number of conventional and advanced molecular pathological techniques.
The Department of Pathology is the center of undergraduate medical education, graduate education, and anatomical pathology residency training at McGill University.
Our residency program, under the direction of Dr. Chantal Bernard, provides training in all major subspecialties of pathology, with extensive guidance from over 50 experienced staff in 8 affiliated hospitals. The program is fully approved by the Royal College of Physicians and Surgeons of Canada and also meets the requirements in anatomical pathology in the United States. Importantly, it provides sufficient flexibility to support individual career objectives. Residents are encouraged to participate in departmental teaching and research projects, and most incorporate 6 to 12 months of either basic or clinical research into their training. Joint seminars with the University of Montreal and an annual departmental research day provide regular opportunities to present case reports and research results, and to interact with colleagues in a wide range of disciplines. In addition, all are expected to present at least one talk at a regional or national pathology meeting and strongly supported to publish in peer-reviewed journals. A clinical investigator track is also available for those residents who are interested in a research-oriented academic career in pathology.
With the wonderful academic staff, a brand new facility, the Department of Pathology at McGill University continue to be the leading academic pathology department in the world. Following McGill tradition, the department has been the center of extensive national and international networking. We welcome you to visit our Department of Pathology at McGill University for education, research collaboration, employment, or any other activities that could eventually benefit our society.